Kendall Tidey, and I'm a therapist at STILLPOINT Counseling and Wellness in Wilmington, North Carolina. Today in this conversation, I've invited a special guest, Alexander Gilmer, to come talk about isolation, the transgender community, and what it means in this kind of time of mandated social isolations. Alexander Gilmer is a clinical pharmacist and also an educator. He did live in Wilmington until last year. He moved to California. He is a good friend of mine and also an amazing educator. And I've also been very lucky to have seen him give a presentation at New Hanover Regional Medical Center. So Alex, thank you so much for coming to be the guest on this conversation.
Absolutely. I can't believe it was last year.
I know. I was trying to think back to what month, and I don't.
It was July.
I can't even think about that. I know.
Yeah, and you'll have to excuse. I just realized it's a little messy behind me, but we're still kind of moving in. So.
Yeah, it makes you look very professional, like you've got a lot going on.
There we go.
So I wanted to start off talking about just the fact that we can't ignore that we're all isolated in some way by government mandate. This is a good time to really, for our society to kind of focus back on people who are in marginalized communities and the fact that they often have experienced isolation. Can you talk a bit about that?
Yeah, I think what we're seeing right now with COVID-19 and some of this isolation is kind of a coin, really, because on one hand, it can actually be really good for the trans community because there are many people who are just starting hormone therapy, and they are, I mean, for them, it's like this godsend that they get to just transition in their house and they don't have to go see people,
Right.
they don't have to go out in the world, and they don't have to, worry about where they're going to go to the bathroom in public and do that kind of stuff because they're home. They have to be home. There's no reason for them to go out. And the trans community really has been online for a very long time. When I first started to get involved in the trans community and start to really kind of explore my trans identity was online with something that was pre-Facebook live journal, but it was very similar to Facebook. And that was my first community, was online, and the trans community has been doing that for forever. Well, I should say forever within this, span of the time that we've been online.
Right.
Before that, it was all through like mail order and phone trees and that kind of stuff. Because it's not always been easy for trans people to get together and to find each other in a physical space. And so on one hand, that is not a bad thing for the trans community as far as having to be home and that kind of thing.
Right.
But on the other hand, it can be very, very isolating because for the most part, many trans people have really felt isolated kind of forever. And the only time they ever really get to be seen, especially if they haven't yet started to physically transition or even socially transition, is when they're in the presence of people who know who they are and love them for who they are, and other trans people and that kind of thing. And a lot of times, especially for our students, they are home with parents and family and possibly people who do not accept who they are and do not accept the thing. Maybe they're in college and they've already started to transition at college and socially transition, and at school they are completely involved in the community and they're out and they're happy how they are, and then they have to go home and not get to have that. And and they're completely isolated and stuck and away from their friends, and maybe their family has even kind of cut them off from some people that they normally have interaction with. And so that piece can be very hard, especially because we know that when we have social isolation, we have an increase in mental illness destabilization. We have an increase in I guess I should say domestic violence, because it doesn't have to be your intimate partner, but kind of anyone, and the people that are at risk for both of those things, trans people happen to be a large community of people that experience those things, and so this puts them at risk for experiencing those things, in addition to not being able to reach out to their friends perhaps the way that they're normally used to.
But I know that our Wilmington support group hasn't had a meeting in 2 months. So that actually, I think especially for new people, has, who have just reached out, just come into the community, has been really difficult. Just moving to a place and not being able to connect in real life.
Absolutely. I mean, I just moved to the San Mateo area myself, literally in March, and and even in Sacramento, it takes a little while to get to find the community, and to it's easy enough to find people online, but it's hard to find people in person, and sometimes that's what you need someone physically present who isn't just a stranger behind a keyboard, but is this person that's sitting right in front of you. And so it's I don't know. I know a few people from the area, and that's just because I've lived in California before, and several of my friends have moved up to the area, but I can't go see them. People that I've that I've known for a long time, I can't go visit them. And so I'm lucky enough to have a wife and a family my wife's family, who all are very accepting and loving and wonderful. And so I don't have to worry about like, okay, well, where can I go to be seen, kind of thing. But I'm one of the few lucky ones that gets to have that. A lot of other people don't get to have that. And especially, I mean, the queer community just, in general, is, community is how we live and die. Community is how that's our family. So many of us don't have connections with our birth family, because we've been kicked out, or we've been shunned, or we've been told that we don't exist, or we've all of those things. And so our family is our community. And so in times like this, when we don't get to access that community and go to places where they are, then absolutely it increases the isolation, especially for your new people that are just getting out there and just starting to meet people, and maybe they just met group like once, and they're excited to go back, and boom, they can't go back.
Yes. Alex, can you tell me if you have personally experienced social isolation, or just that feeling of lack of, community in your life?
I think definitely. So definitely in my life, I mean, for a long time, I didn't know anybody that was trans, and I'd never seen anyone that was trans, and I'd never, didn't know that these things that I was feeling inside were things that other people felt, and that's one of the things that you get when you have community, and you get to go and you are sitting in a room with someone, and they're saying, oh yeah, I felt exactly that way when I was, first coming out, or I still feel that way. The other day I went to Walmart and, such and such or whatever. And, and so there's definitely been an element of isolation. And as much as, as much as my wife is welcoming and wonderful and, amazing, and, sometimes is better at remembering, how do I say this?
I'm waiting for what you're going to say.
I know, right? Remembering like pronouns and things like that, you know, like sometimes I don't click to they right away because I'm that's a newer pronoun for me. And so, but she'll immediately go into they. If she has no idea what the person's pronouns are, she'll immediately go into they. And so what I'm trying to say is that, you know, as wonderful as she is, she is not a trans person. And so she doesn't live a trans life. And so there are things that, you know, sometimes, like for instance, I was trying to set up a doctor's appointment and I'm out. I've been out for a while. I tell my doctors who I am and my background and everything. And it is still hard and I am in healthcare, and it is still hard to go to a doctor for the first time. And I remember saying, just kind of being nervous about setting up my first doctor's appointment. And she was like, oh, well, just pick someone and, blah, blah, blah. And it's kind of like, yeah, I don't get to have that. Like, I don't get to just pick someone because I have to screen them and I have to find out if, are they going to be someone that knows how to take care of me? Are they going to be someone that not only knows how to take care of me, but is going to be kind to me? Forget even taking care of me. Are they going to give me the medications that I've been taking for 10 years? Are they going to continue them? Are they going to, is there going to be a problem if, that kind of thing. And, and so it's really important to be able to sit and talk about that stuff with other people and to get connections. Oh, well, I go to see so-and-so and they're awesome and that kind of thing. And that's some of the stuff that you get when you get to sit around and kind of chat with some people. And you get that a little bit online and stuff, but sometimes you don't get the same stuff.
Yeah, and it's your local community as well when you see
Right.
people face to face. And I think back to that, well, often my reflection on what I and probably other people experience is what taking for granted those things, like being able to schedule a doctor's appointment without having to worry, without having to feel vulnerable to just, having that conversation, or finding someone who might be nice but isn't knowledgeable or really that welcoming.
Right. I mean, and even, coming out to, everyone thinks of California as like this big, mecca of like, oh, well, it's all welcome and everybody's open and so knowledgeable and stuff. And I called my healthcare office and tried to find out, who are some trans-friendly, trans-knowledgeable doctors, and was told, oh, everybody's everybody's knowledgeable on that. And as an educator of physicians and healthcare providers, I know that's not always true. And it's not for lack of wanting to be educated, it's just lack of experience. Right. And so I was personally looking for someone that had a little more experience, and I was told, oh, everybody is. And that's like saying everybody knows exactly how to take care of diabetes. Like, yeah, most people can do it, but it's not like their specialty, and so I picked a doctor and I went, and she, I asked to be referred to the specialty clinic, and she asked me why I wanted to do that. I could just, she could just take care of me. And she, then I asked, well, is there anyone that specializes in trans, healthcare? And she said, oh, well, nobody does that. I mean, there's not very many of you, right? And
Oh gosh.
and and then I, when I asked to be referred to the specialty clinic, she says, oh, I can take care of you. And then she says, well, do you need any labs? And I said, well, no, I actually got labs right before I left, so I don't need them for a while. And she says, oh, good. I didn't really want to do that. I don't really know how to do anything with those labs. And it's like, you literally just told me that you could take care of me, and you're also telling me in the next sentence that you can't. So like, and so it's not that she wasn't unkind or anything like that.
Right.
She just didn't know what she didn't know, and so
and as a therapist, I see that quite a bit. People coming in, clients coming in saying, my therapist was really nice, and she or he said that they were very trans affirming and friendly, and the response was, well, that's wonderful, but I need someone who understands people don't want to have to explain to a doctor or a therapist to educate them on what they're supposed to be the expert at.
Right.
Yeah.
And I mean, that's the thing, is that, like, so I'm in healthcare. I'm a pharmacist. I am also an educator on trans healthcare. I educate physicians. I educate providers. I educate, all the run of people who are involved in healthcare. And there's part of me that, I don't want to necessarily have to educate when I go to the doctor.
Right.
But the thing is that I'm lucky. Like, I know what I need. I know what doses I need. I know I've been on testosterone for at least a decade. I know what labs I need. I know what the labs should be when they come back. I know what adjustments I should make when they come back. I know how to get my medication. I know how to, do a prior authorization. I know how to, if I even need a prior authorization, I know what needles I need. I know all of these things. I am probably, like, maybe one of 10% of the population that knows all of that stuff. Trans people in general, and I know that from talking to trans people, but I also know that from talking to other providers who take care of trans people. Trans people in general are very knowledgeable about what they need in their care. Not just even hormone therapy, but just kind of in general, because they've had to be, and they've had to educate providers. However, we shouldn't expect these patients to know all of this stuff. And yet that's kind of what we're doing, is we're expecting these patients to come in and as healthcare providers, tell us what they need. And we don't have that expectation for any other kind of patient, any other person that needs specialized care. And so why do we have it for our trans patients? And so trans patients, they don't want to go see someone, because they're going to have to educate, or they're scared, or, before COVID and before all of this, a quarter of trans people put off healthcare because they're afraid of being discriminated against. Yeah, absolutely. I think healthcare providers, really everybody in general, they don't go into something thinking, I'm going to do this wrong. And they go in thinking, I'm going to do this right. I'm going to do the best I can. I'm going to do this right. I'm going to take care of this patient. I'm going to get them everything they need. I'm going to find out what they need, and I'm going to do everything I can to provide what they need and take care of this patient. But the thing is I don't think a lot of people, it's interesting because trans people are a specialty, but they're also not a specialty, right? Trans people are just like every other patient. They get diabetes, they get heart failure, they get, depression, they get ADHD, they get, they have all of the other things that everybody in the general population does. They want to lose weight, they want to quit smoking, they want to, just do all these things. And so in that respect, they're really pretty just like a basic patient or whatever. And honestly, hormone therapy is really not that complicated. A lot of times it's driven on essentially the patient's desires and their goals of treatment, just like many of our other medications are driven. We have some levels that we can get, and that'll help guide our therapy and stuff like that, but it's really not as complicated as a lot of people think it is. Mm-hmm. However, that being said, knowing about, how to ask for pronouns and how to discuss pronouns, and how to find out what a patient is needing and what they're looking for, and knowing that just because someone was assigned female at birth and they identify as trans doesn't mean they want to necessarily look like me, for instance. And what I mean by that is, just kind of go all the way to the other side and grow a beard and be masculine and all of that. They may want to be somewhere in the middle because that's maybe how they identify their gender. And that's where more of the specialty comes in, honestly, is not so much with the care and the general medical knowledge, but the navigating stuff that, sometimes there isn't a ton of education out there. And like you said, the doctors would like to, healthcare providers would like to be taught. And I think some of that has to do with, some of that is based in a fear in a way, because what if I can't find out the right information? Or trans care is, because we haven't been involved in a lot of studies that have been really focused on transgender and non-binary care. There isn't a lot of evidence-based guidelines that are really explicit on how to take care of patients. When you look at the diabetes guidelines, I mean, they are like, if their A1C is this, then you do this. If their A1C is this, then you do this. And it is very lined out. If their blood pressure is this, then you do this. If their cholesterol is this, then you do this, that kind of thing. Whereas it's much like with, I think, therapy, right? Like there's a lot of guidelines that are out there, I'm sure, but they're guidelines. They're not, distinct of, like, if a patient comes in and they have, X amount of symptoms, like, that's, every patient's going to be different. And
nothing's black and white, it's all gray.
Exactly. So it's kind of like more like an art, right? And so that's a little bit like trans care in some ways. But it's really comes down to the human interaction, and that's where people, I think, can learn the most.
Yes, and I remember one thing from your seminar saying that, sometimes it's just the fear of asking, like, what pronouns would you like me to use? Or, what would you like me to call you? Or, just speaking directly and very frankly with the patient, rather than the fear of, oh my gosh, I don't want to get this wrong, so I'm just gonna not say anything,
Exactly. Yes. We're all afraid of failing. We're all afraid of doing something wrong. We're all afraid of offending people.
Right.
And that is a big thing that keeps us back from, and keeps a lot of people back from, asking pronouns, asking preferred name or name that they use, and really talking to people about not only their gender identity, but also their sexual orientation, and how, how that intersects with their health and their well-being as a person. We're so afraid to, there might be a train that comes by in a minute, and I apologize because it might be blowing its horn. So, but a lot of people are worried about, that offense. But the thing is that when you offend someone, I mean, we all have an established, what do? We apologize and we move on. Because the thing is we offend people all the time.
Right.
All the time, for all kinds of things that we could never pick out ourselves as something that would be offensive to that person. And so honestly, by asking someone their pronouns, especially if you have any kind of question at all, by asking them their pronouns, you might in fact be the first person that day, that week, or even that month, especially in this COVID situation, that actually got it correct. Because, I guarantee you that the person who, was sitting across from them in a meeting, they didn't know, the last Zoom call they had, probably 90% of the people on the Zoom call didn't know what their pronouns were, and used the incorrect ones. And so by asking them
altogether, and that's awkward.
Exactly. Yep, exactly. Or ignored the fact that there could be a difference in pronouns, all of those things. And what that does, by not asking pronouns, by ignoring pronouns, basically you're essentially saying to the person that I don't see you, you're invisible to me.
If people are so nervous about offending, or so nervous about saying the wrong thing, the avoidance of that, the fear of that, and the avoidance can really create an isolated experience for a trans person.
Exactly. Especially right now where we're, I don't know about where you guys are, but here we all have to wear masks to go into any public place, right? So if we go into a grocery store or, a gas station or whatever kind of thing, we have to wear a mask. And those masks can be both, a good thing and a bad thing. It can be a good thing because it might hide part of the face that maybe otherwise would give someone off as being not the gender identity that they identify as, but a bad thing because it also might hide part of the face that normally would indicate to someone, oh, that's a woman, or oh, that's a man, or oh, that's they would use they pronouns, or or something like that. And so it's just another more of a chance to ask pronouns, because we can't see each other behind these masks. Like I started a new job, and I've worked with people for about a month now, and I've seen maybe 2 or 3 of them without their mask on. So like when I meet all of them again without their masks, it's going to be a whole new meeting.
Right.
So just think about that when you're meeting people out in the world. Like, you have no idea what gender identity they are. You could see them and they have short hair, and you could think, oh, well, that's obviously a male, and it could absolutely be someone who strongly identifies as female. We don't know. And even without masks, you can't tell by seeing someone. There are plenty of people in the world that look like me and you, and would prefer they pronouns, because that's the pronoun that makes sense to them. Just because someone looks really masculine, or just because someone looks really feminine, or something like that, does not mean that you can assume what their pronouns are. And that goes for people who look more androgynous. They might.
Isolating is, the feeling that many transgender people have of often not being seen as they are, but sometimes being seen too much. Like that I could walk into a restaurant and not have to have the weight of people staring or wondering if they are staring. Or how would you kind of respond to that type of isolation? And what can we do as a society to address the fact that there are, marginalized communities that need to be seen?
I think when it comes to that, because that is something that I haven't necessarily dealt with recently, but it's something that I definitely dealt with as a college student when I was kind of in an in-between stage. It was just, constantly being, I could go into a store and be followed because I was, a riffraff of some sort, even though I was, 25 years old, and clearly not doing anything that, would be an indication that I would be stealing or doing whatever, but I looked like I was, 18 or 20. Or go into a restaurant. I went to Olive Garden one day with a bunch of people who had gender presentations that were not, just your stereotypical male, female. And we were given, extremely poor service, and the, waiters and waitresses were just rude, and would leave for forever, and not come back, and we'd see them dote on other tables right near us, over and over, and then just skip right past us, that kind of thing, or stares, or being told that I'm in the wrong bathroom, or all of those things. I think the thing that the general public can do, especially, if you don't know the person or whatever, just be kind. Yeah. Just treat them like you would treat a family member or a friend that you cared very much about. If you see that let's say that you have someone that maybe looks a little more on the masculine spectrum. Maybe they were assigned male at birth, or you assume that they were assigned male at birth, but they clearly have some feminine features, and and have chosen, because every time someone goes into the bathroom, they make a choice. And so, yes, there are occasions when you walk into the wrong bathroom, not on purpose, but those are pretty few and far between. Generally, if someone is walking into a bathroom, especially if they're confident and they have seen the other people in the bathroom, that is on purpose. And so if you were to see that and see someone giving that person a hard time, speaking up and saying, oh no, you're welcome, you're obviously in the right bathroom, or something along those lines, that would be life-changing for that person.
Yeah, and I mean, that's a wonderful way to put it, because it really just takes that moment of speaking up for someone else. someone
Yeah.
who's not in your position. And like you said, just the basicness of being kind. I remember, some people in group talking about questions that they would be asked about very personal information about their bodies. And I remember thinking, I was not raised like that. I would never ask anyone about their bodies. I was actually kind of shocked that many in the trans community are specifically asked about their bodies. I just find that incredibly rude, regardless. And I just think that sometimes when a marginalized community is just expected to have to deal with those types of questions when
Abs-
other people wouldn't.
Yeah, absolutely. I mean, I think that a lot of times there is that expectation, Laverne Cox, I believe, was someone that really kind of put it out to
Okay.
the public, awareness that those kinds of questions were not necessarily appropriate, because trans people in interviews get asked questions like that all the time. And she was I think Janet Mock has probably said something. I'm sure other trans people have said something as well, but it was Katie Couric, and she a very well-known person. And so to have her be told, that's not really an appropriate conversation for us to have, was, I think, mind-blowing for the general public. And it really shouldn't be, because nobody's having those conversations if you're not trans. You're not asking someone
Right.
about their surgeries, regardless of like the privateness of bodies. You're simply not asking strangers about surgeries.
Right.
You're not, you don't go up to someone that maybe they have a scar, or maybe I have no idea, but you don't go up to, someone that you've never met before and ask them, oh, where did you get that scar? You just don't ask those questions,
Right. And I mean, that's what struck me, is that to me is just common manners. And to not be to not be treating everyone with the same sort of value, to the same values and respect, means that you're thinking less of them. Does that make sense? That was
Yeah.
not beautifully said, but
No, I think it was. I mean, I think we see this in marginalized communities all the time, not even just the trans community.
right.
We see this in communities of color, and communities of different religions, where we just expect them to answer our questions and to, and so that's, I mean, that's something that are, trans people of color, or, trans people that have different religions, for instance, Muslim trans people, it might be more out in the open. They have to deal with those, basically kind of the intersection of both of those things, right? I happen to be a male of trans experience who is a white, male who is about middle-aged.
We're the same age. We're not.
I don't know about you, but I just turned 40, so.
Right, I'm older than you. Okay, forget it. Baby.
And so I get it pretty easy, right? I get it pretty easy in this world, comparatively. There are a lot of people who don't get it that easy. And so on top of the questions that they get if they're trans, or the questions that they get because they're, Black or brown of some, some different color, that, basically on top of those things, we pile both of those on, right? And so all of the things that they have to deal with because of this identity, they then have to deal with and have it compounded because of this identity. And one of those things is asking about bodies, touching hair, touching bodies, touching, reaching out and thinking that that's appropriate. Trans women of color not only have to deal with the body stuff that they have about, the trans stuff, and asking about their surgery, and asking about, do you tuck, and this and that, and I can't, you look like a real woman, and all of those things. They also have to deal with the fact that they are a Black woman, and so people feel that they can just touch every Black woman's hair, and all of that kind of stuff, and same with just different different communities. It's the same thing. I mean, marginalized communities all over have to deal with just these different expectations that we don't have for other people.
And the expectation that they have to be like a human Google,
Yes,
just saying, let me take my time to teach you about transgender people and, you know, people of
absolutely.
color.
I
So,
don't have a problem teaching. I really don't. I enjoy it. I love it. But I have been out. I have, identified as trans for about 15 years or so. This is not new to me. I've, worked through all of the trauma that I grew up from, being trans on top of, just general life trauma or whatever. I've worked through a lot of that. So I don't, there's none of that. There's very few triggers and that kind of thing. This is something that I generally have a passion about doing, but I am not everybody. I am one person,
right,
and most people don't feel that way. I mean, most people in the world don't want to answer questions about, especially about just super personal things,
right,
just in general. And I think a lot of times that's exactly trans people, or people of, in marginalized communities in general, just are the token person, right? So, oh, I see this Black woman is in my, my meeting. I can ask her all the questions I have about Black women, instead of actually taking the time to go learn about what it is to, maybe walk in this world as, as a woman of color or something like that. It's the same thing with trans people. If you have questions about trans people, there may be some trans people out there that are absolutely willing to educate and have a wonderful conversation with you. But you should not expect that. Should not be an expectation, because there's a lot of resources out there that,
right.
that you can reach out to and kind of learn more about the community and people in general.
Absolutely. And Alex, before Zoom kind of kicks us off, I know there's some 40-minute limit or something.
Oh,
I
that's right.
want you to talk a little bit about what you do as a trainer, and like maybe if you have any education opportunities in the future.
Absolutely. So basically, I do I do some Trans 101 stuff, which is just, I teaching you about the history of trans people, about, what assigned sex at birth means, what it has to do with your gender identity, just development from birth, and how, some of the ways that we think, transness kind of happens, as well as just the experiences that trans people have from childhood to, adults to older adults, because those are all different lifetime spans and different experiences during that time, as well as, how to ask for pronouns and how to have those discussions, and all the way through to how to actually dose medication, and what kind of surgeries do trans people have, and what kind of recovery do they need to have after those surgeries. If you're a medical provider and you're taking care of a trans person after their surgeries, whether you're a social worker or a therapist, or you're a nurse practitioner, or however, there's going to be different things that that trans people need, following surgeries, or following the start of medication, or that kind of thing, or following just social transition. And so I do a lot of education kind of about really all of that. I focus on trans people in healthcare, and how we can better, as a society and as healthcare providers, take care of our trans patients and provide for them. I'll actually be putting together and doing a free webinar coming up. And so if you are interested in being involved in that, and getting that training, then I'm about to put up my email on the screen. So if you could just email me and put webinar in the subject, then I will get back to you with that training, and we'll put together a date that works for the majority of the people that contact me. And so you don't have to be, you don't have to be in the like a nurse practitioner or a physician or something like that. I can, if I find that my audience is the majority, therapists or social workers or case managers or psychologists, I can gear the webinar towards that, because I also have experience in teaching just basically all kinds of providers, and kind of really I can focus on some of the things that therapists really should start to learn about their trans clients and trans patients, especially if they're really interested in working with more trans patients, or maybe they realize that they have a trans patient and they've never had a trans patient before and don't have any idea what to do. You know, that's absolutely something that I can gear the webinar towards. And so yeah, so reach out to me, and
that's an amazing resource. Thank you so much for providing that, and thank you so much for being on my, I don't really know what to call it, but our discussion. I think it was super informative, and always a pleasure to talk to you.
Absolutely. And if for some reason you missed the email, Kendall has my email, so you
please
can
contact me and I will send it to you.